This is a breathing technique that we incorporate into all of our classes. You will hear it referred to as the core breath or the piston breath. What this breath is doing is it is helping us connect with our deep core system. So we are connecting in with our diaphragm, our pelvic floor, transverse abdominals, and our multifidus. We're going to start here just by feeling the breath coming in and out of your nose. And now as you continue to feel that breath flowing in and out of your nose, place one hand onto your rib cage in that space where your bra strap may rest. This time as you inhale, feel your rib cage expanding into your hands. And as you exhale, feel your rib cage hugging back in towards the center of your body. With each inhale, rib cage expands. With each exhale, rib cage hugs back in. Beautiful. Try that a few more times. Now take your mind and allow your mind to explore into your pelvic floor. So our pelvic floor are the same muscles we would use if we were to stop ourselves from urinating midstream, stop ourselves from passing gas. Our pelvic floor sits in our pelvis like a sling or a hammock, connecting from the front of our pubic bone to the tailbone and out to the sit bones, those two bony parts you feel when you're connected into the earth here. This time, take a deep breath in, expand through the ribs. Encourage your pelvic floor to relax and lengthen. Try that again. Take a nice deep breath in, expand the ribs, pelvic floor relaxes and lengthens. We want to be mindful that as we encourage our pelvic floor to relax and lengthen, this is not a bearing down or a pushing. It's a very subtle movement that you may not even really be feeling. We want to connect our mind to that area of our body because over time, when that mind-body connection continues to strengthen, we'll begin to talk to our muscles and to our ligaments and our connective tissue, and our body will start to know what we want it to do when we would like it to be done. So take a deep breath in, expand the ribs, relax and lengthen through the pelvic floor. Now this time as you exhale, I want you to imagine there's a blueberry just sitting to the outside of the vagina, and I want you to pick up that blueberry, lift and draw it up into your body. Inhale, ribs expand, lower that blueberry all the way back down to the earth. Exhale, pick up that blueberry, lifting it up into the vagina. Beautiful. Continuing here, connecting the breath to the pelvic floor. With each exhale, that's when we engage and lift the pelvic floor. And with each inhale, that's when we soften, lengthen, relax. Beautiful. We're going to add on to this here. Now, when I'm teaching this to my students for the first time, I will most likely only teach that portion for the first class, and then I will add on afterwards. But I want you now to connect into your transverse abdominals. Remember that wire we were using to tighten from hip to hip, hip up to belly button. This time, inhale big, feel the rib cage expanding. Lower that blueberry, relax, lengthen. This time as you exhale and pick that blueberry up into the vagina, tighten those wires, hip to hip, hip up to belly button. Inhale, relax the wires, lower that blueberry back down, all the way back outside the vagina. Exhale, pick up the blueberry, tighten the wires, hip to hip, hip up to belly button. Beautiful. Continue this breathing pattern at your own pace.